Hello everyone, I'm lactation consultant Pei Xie. Welcome to the video on feeding and caring for a baby with cleft lip and palate. After the baby with cleft lip and palate is born, I think the parents are most worried about feeding. I hope that this video can improve your knowledge and skills about how to feed babies with cleft lip and palate. In the previous episode, we learned that cleft lip and palate can be classified into 5 types according to the location of the defect and extent of the opening. Type 1 is cleft lip, affecting only the lips. Type 2 is cleft lip combined with alveolar defect, and it may also have an opening that extends up to the bottom of the nose. Type 3, the opening extends from the upper lip to the alveolus and upper jaw. Type 4 is cleft palate. The affected area may be only the soft palate, or both the soft palate and the hard palate. Type 5 is submucous cleft palate, with defects mainly in the velopharyngeal valve. Due to the anatomical defective structure, babies with cleft lip and palate may have difficulties in latching onto the breast, cannot maintain oral negative pressure, which leads to poor sucking, and this is the main cause of feeding difficulties. Since the babies with type 1, type 2, and type 5 cleft don't have defects in their upper jaws, mothers can feed them by breastfeeding. Here are some tips for breastfeeding a cleft lip and palate baby. First, wash your hands. Hold the baby in an upright position, and then use the breast or thumb to seal the gap of the baby's lips to form a vacuum for breastfeeding. Even if the milk comes out of the baby's nose, the baby is less likely to choke because of the upright position. And if nasal regurgitation happens frequently, you can pat the baby's back to help him burp the air. When feeding type 1, type 2, and type 5 cleft babies with bottles, if you are using a normal feeding bottle, it is recommended to choose one with Y-cut or X-cut teats. These teats can regulate the milk flow by the squeezing force, so the baby is less likely to choke. As for type 3 and type 4 babies with cleft palates, the baby's sucking ability is weaker, so the milk will easily come out from the cleft and nose while feeding. It is recommended to use a special bottle to increase the baby's milk intake. If you don't have a special bottle or it does not work for your baby, you can try using a spoon, cup, syringe, or a dropper. In general, it is easier to control the food portion size by spoon feeding. It can also prevent food from falling out of the mouth. Or you can remodel a normal feeding bottle by turning the teats over and use a knife to create a little Y-shaped or X-shaped incision on the tip of the teats. Before the demonstration with a special bottle, let me introduce you to a special bottle for a cleft baby. There are 4 common brands of special bottles, and I'll introduce one of them here. The special bottle is unique in that the teat is larger and softer, so babies can push the teats against their gum line or use their tongues to get the milk. And there is a one-way valve at the base of the teat, which can reduce the baby's air swallowing while feeding. The Y-cut teat is thinner on one side and thicker on the other. Place the thicker side against the baby's upper gum and the thinner side on their tongue. A small notch near the rim of the teat serves as an air vent, and it should be under your baby's nose when feeding. The 2 teats that come with the bottle have 2 different hole sizes, suitable for babies at different months of age. Furthermore, parents can also adjust the milk flow by tightening or loosening the teat. Next, I will demonstrate how to feed a cleft baby with a special bottle. First, hold your baby upright, sitting with support in a 45-degree position. Second, the teats should be placed towards the complete lip, palate, or inner cheek. Do not place it towards the cleft to avoid abrasion of the cleft palate or nasal mucosa, since it may cause pain and affect the feeding amount. Third, babies with clefts may swallow more air during feeding, so remember to pause, gently pat the baby's back, and help him burp to avoid vomiting. It is common for some milk to come out of the baby's nose. Don't worry. Fourth, if the burp is unsuccessful, you can raise the baby's head slightly and let the baby sleep on his or her side. If the milk is reflux, it can drip down from the corner of the mouth or nose. Fifth, after feeding milk, also feed some clean water or use a cotton swab with cold boiled water to clean the baby's nostrils, jaws, tongue, and gums to avoid oral infection due to buildup of milk residue. 6. Keep each feeding time less than 30 minutes. Longer feeding time means your baby used too much energy for sucking, which may cause him to have difficulty gaining weight. If this happens, it is recommended to consult a medical professional to adjust the feeding method. Infants need about 120 to 180 milliliters of milk per kilogram of weight each day. For example, if the baby's weight is 5 kilograms, the total amount of milk per day is about 600 to 900 milliliters. However, this is only a general principle. If the baby drinks less than this amount, but the baby's height, weight, and head circumference are all developing normally, you don't need to worry too much. When breastfeeding, because you cannot see the amount of milk your baby is drinking, the mother often worries whether the baby is getting enough milk. You can check by the number of diapers changed daily or by the urine color and smell. From the 3rd day after birth, the baby should urinate 6 to 8 times in 24 hours, which means he will need to change at least 6 diapers per day. If your baby is drinking enough milk, his urine should be colorless, clear, or pale yellow color and odorless. If your baby has signs of dehydration, such as no urination for more than 6 hours, dark yellow urine or crystallized urine, little or no tears when crying, dry and sticky lips, much less activity than usual, etc., please consult a medical professional. Generally, palate repair surgery is usually performed when a baby is at 9 to 15 months of age. In order to protect the wound in the mouth, pacifiers and feeding bottles should be avoided for 1 to 2 weeks after the operation to reduce the possibility of wound dehiscence. Therefore, before the baby receives palate repair surgery, the baby should get used to feeding methods other than bottle feeding. Babies with cleft palate can follow the same parenting advice as babies without clefts. After birth, babies should be fed mainly with breast milk or formula milk. As the baby's digestive system becomes more mature, parents can start training babies to eat solid foods at about 4 to 6 months of age. Some parents may ask, can babies start trying solid foods until after the palate repair surgery? Although it can be challenging to guide your baby to eat solid food, it is not recommended to delay trying solid food until after the surgery is performed. Eating solid food not only trains a baby's chewing and swallowing ability, but also provides the necessary nutrition for growth and developmental needs. Some parents may be concerned about how the baby drinks fluids if bottles are not recommended to use within 1 to 2 weeks after the palate repair surgery. When babies are 6 months of age, they can start practicing cup feeding. Babies may not be used to it at first, but after a few practices, they will learn to press their lips against the rim of the cup to drink. There are no absolute feeding standards for babies with cleft lip and palate. In different countries, medical professionals may have different suggestions. We should observe each baby's physical needs and performances and find out the most suitable feeding method by discussing with the medical team. In this video, we talked about how to feed a baby with cleft lip and palate, including breastfeeding, bottle feeding, and the preparation before palate repair surgery. I hope you have learned something from this video and will use it to help cleft babies eat better.